Hello, and welcome to another episode of 3 and 5, an educational series for hospital executives brought to you by CompleteRx. I'm your host, Senior Marketing Specialist Rachel Rahm. In today's episode, we sit down with CompleteRx Area Clinical Manager Jennifer Siegel to discuss a proposed new ruling by the HRSA to remove two items from the vaccine injury table. The first is shoulder injury related to vaccine administration, or SIRVA, and the second is vasovagal syncope, or fainting. So welcome, Jennifer. Thanks for joining us in today's episode.
It's my pleasure to be here.
So Jennifer, let's talk about the newly proposed ruling by HRSA. Would you first offer some detail about what exactly was proposed and why?
Absolutely. The Health Resources and Services Administration is proposing to remove shoulder injury related to vaccine administration. They call that SIRVA, and vasovagal syncope, which is fainting, from the vaccine injury table. Currently, these are covered under the National Vaccine Injury Compensation Program, and they were added to the vaccine injury table in FY17. So prior to fiscal year 17, shoulder injuries made up a tiny percentage of vaccine injury claims filed to the program. And in the few years after being added, they dramatically increased to make up over 52% of claims. So the HRSA believes that these claims, which are not associated with the vaccines themselves or their components, erroneously suggest that vaccines are less safe than they actually are, as well as putting a drain on this trust fund. Shoulder injury and syncope associated with vaccines likely results from poor injection technique. The timing of this proposal, as our country is expected to deliver tens of millions of COVID vaccines, really shouldn't be a great surprise to us.
Yeah, no, that's definitely very interesting timing. So what exactly does this mean for hospitals and their providers?
If they do remove shoulder injury and syncope from the vaccine injury table, the injured party then has to file a claim in state court against either the vaccinator and their employer, which could be our hospitals, as they have taken the task of vaccinating not only healthcare workers, but patients and even the community at large. Hospitals and vaccinators would have to seek additional liability insurance, and it could even discourage healthcare providers from administering vaccines, making the COVID vaccine that much more difficult to access.
So Jennifer, I heard you mention that shoulder injuries related to vaccines have increased around 52% in the last few years, likely leading to the proposed ruling. Is there something organizations can do to help decrease the number of shoulder-related injuries?
Absolutely. Training your employees is one of the best forms of decreasing these injuries as an organization can do. So here at CompleteRx, we started over a month ago, so late in December, by rolling out education to our pharmacy staff, our vaccinators, our nursing staff, and we created in-services to discuss how to appropriately inject the vaccine, the COVID vaccines. And then we also directed our vaccinator staff to get more CEs. The CDC is offering free CEs to vaccinators right now. We have to consider the fact that some vaccinators may not have done this in years since their initial training, and we need them to keep up their skill sets. So skills labs could be a potential offering of organizations before we send our vaccinators out to the community.
Awesome. Great. Well, yeah, the more we do, the better it is for everyone. Well, thank you so much, Jennifer, for sitting down and shedding some light on this proposed ruling and what it might mean for our listeners. We really appreciate your time and your insight.
Thanks, Rachel.
Thank you for tuning in to this month's episode of 3 and 5. If you enjoyed the content, please give us a like or share, and don't forget to subscribe to our social channels to keep up with this series and much more content from CompleteRx.